What's new in 2023 for remote patient monitoring, or RPM? In this video, we'll discuss everything you need to know about the CPT codes for RPM so you can properly code and bill for this program. Hey, this is Jared with ThoroughCare. Here at ThoroughCare, we specialize in helping practices manage, bill, and streamline reimbursements for volume-based programs like RPM. Remote patient monitoring is a Medicare program for remotely monitoring patients' vitals, and it has several billing codes associated with it. If you'd like a reference guide for the RPM CPT codes that we'll cover in this video, you can download one from our website. There's a link in the description below. So what are the 2023 updates for remote patient monitoring? Well, there were no major changes to RPM rules and regulations in CMS's 2023 final rule. There are updated reimbursement rates for the CPT codes, which we'll cover. Keep in mind, the codes are based on national averages, which may vary in your area. For the exact current rate based on your location, visit the Physician Fee Schedule website. CPT codes for remote patient monitoring are broken into two categories, device-based and time-based, and there's a separate requirement if you're a rural health clinic or a federally qualified health center. Let's start with the device-based RPM codes. The first CPT code is 99453. This code is for the initial device setup, where the device is given to the patient and you explain how to properly use the device. 99453 can be billed once per device. If the patient is given multiple devices, they must be billed with the code 99453 on different months. The current national average reimbursement for 99453 is $19. The other device-based code for RPM is CPT code 99454. This code is for daily device use and monitoring. A patient must take at least 16 daily device readings per month in order to trigger this code. This code can only be billed once per month, no matter how many devices the patient is using. If the patient has multiple devices, you can total the daily readings from those devices to reach 16 daily readings. 99454 has a current national average reimbursement rate of $50. Now let's look at the time-based RPM codes. The first code is 99457 for at least 20 minutes of non-face-to-face RPM services per month performed by clinical staff. The clinical staff can be a certified nurse assistant or certified medical assistant or higher on your staff. 99457 has a current national reimbursement of about $49 per month. There is also an add-on code, 99458, which can be billed concurrently with 99457 and is for an additional 20 minutes of RPM services. It is billed at 40 minutes and pays about $40 per reimbursement for a total of $89. 99458 can be billed a limited amount of times per calendar month, so at 40, 60, and 80 plus minutes. Lastly, let's talk about remote patient monitoring for rural health clinics and federally qualified health centers. For RHCs and FQHCs, it's still possible to provide RPM services. They just cannot bill for RPM with the codes we previously talked about. They must utilize a more general CPT code, often applied to chronic care management. This CPT code is G0511. Our suggestion is to give a patient an RPM device, log 20 minutes, and bill for code G0511. It pays approximately $78 per patient per month. G0511 can be billed once per month per patient. So if a patient participates in CCM, you cannot also bill G0511 for RPM usage. It's one or the other. So now that you have a better understanding of the CPT codes for RPM, what should you do next? If you'd like to dive deeper, there's a link in the description below to our Learning Center, where you can read and learn about RPM as well as other value-based programs. And don't forget to download your free reference guide for the billing codes we discussed in this video. Please like and subscribe. Thank you for watching.